The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh. We're glad you've joined us today for our program. We're going to be talking about diabetes today, and maybe you or someone you know has this disease. If they do, they'd want to tune in, maybe give them a call right now. We're going to be talking with Dr. George Guthrie about diabetes. Dr. Guthrie is a physician at the Lifestyle Center of America in Oklahoma, and he's been there for a number of years. Before that, he practiced in family practice for about 14 years. He's also been a university professor, talking about public health and nutrition type things in his teaching, and we're glad to have him with us. Welcome, Dr. Guthrie.
Thank you, Don.
Today we're going to be talking about a disease I guess is impacting millions of Americans and has been escalating in this country and around the world, diabetes. What is diabetes and what causes it?
Boy, that's a good question. You know, we get confused if we talk about diabetes as one disease. There's actually several different, we call them kinds of diabetes, and in some ways they're actually opposite diseases. Why don't we focus today on type 1 diabetes?
Great. I mean, we haven't done a program exclusively focusing on that, so I know it'll be really appreciated. What is type 1 diabetes?
To explain what type 1 diabetes is, let's first talk about what normal physiology is. Stop to think about the way we're created. Food is put into the mouth, chewed, goes down the esophagus into the stomach, kind of mixed up a bit with enzymes. Digestion begins. Food then goes into the small intestine and is absorbed into blood vessels. Some of those blood vessels actually go to a small organ behind the stomach called the pancreas. There in the pancreas, cells called beta cells, and I'll end up referring them to that again later, so might as well lay it right up front. Beta cells whose job it is to respond to the energy coming in and say, there is energy coming. The hormone that goes out is called insulin. It goes to the cells of the body, throughout the body, and they, listening for the hormone, then open up and say, I guess it's time for the energy to come in because the hormone has sent the message. I sometimes call this hormone the Paul Revere hormone because it's sending out a message.
And Paul Revere was that guy that said the British are coming?
That's right, but insulin is saying the energy is coming.
Okay. And so the insulin goes out and just lets everybody know there's help on the way.
There's energy coming, and they open up according to their particular need. Now, if we want to look at type 1 diabetes, there's a problem with this process. Sometime an infection comes into the body, usually a viral infection, ends up attacking the pancreas. The beta cells, the one that make the insulin.
The Paul Reveres.
No. These are the
horse.
cells that the cells that actually make the Paul Revere hormone.
Okay.
And make them sick. The body recognizes that there's an illness there and comes out to fight it. Instead of just fighting the infection, there's some confusion that takes place in the immune system, and the body begins to fight the beta cells and eventually kills them.
Okay, so it's actually fighting itself, and it kills the very things that are needed to produce insulin.
So there's no insulin, so the cells out at the periphery don't get the message. There's in essence a block.
Okay. So is it possible that it's not true then? I've heard many times people say that sometimes you're just born with type 1 diabetes. That's not true then?
We understand type 1 diabetes as being in the category of autoimmune disease. Now, at least when it starts.
Okay.
Where the body gets confused about what it should fight and shouldn't fight, and actually turns around and fights itself.
So when a baby is born, it's not born with type 1 diabetes then?
I've never seen one. I've never really heard of one.
So, but sometimes people get this very, very young, and you're saying it's caused by an infection. Let's say the only thing the baby has been drinking is milk. Could someone get type 1 diabetes from its mother's milk?
There has been an association noted between cow's milk and diabetes type 1. But I don't know that we could say it's actually the cause of the disease, because the problem is in the immune system. There's two parts of the immune system. One part of the immune system says, go get it, we got a problem, we got an infection, we need to take care of it. The other part says, wait a minute, hold on, we don't want to fight quite so hard on that. And if there's an imbalance in that immune system, so the go get it gets too strong and overcomes the no, you better not do it, we have the immune system then fighting self.
So it could be just an overactive, it's a good thing. I mean, immune system's a good thing, right?
Right.
But it's just maybe overactive at this point and does almost too good a job, so to speak.
So you brought up the question of milk.
Right.
If a protein of some kind, such as milk, gets into the body's immune system and begins to confuse the immune system. The immune system is a little bit weak. Sometimes there's an association of proteins or something, and it may weaken the immune system enough so the body is likely to get confused. And I think that's probably the connection between the two, although I don't know that it's nailed down for sure.
So, I mean, this is kind of maybe off the subject, and you can tell me if it is, but if someone is in a family that is subject to, say, allergies or responses to do they have to be a little more careful, would you say?
You bring up a very good point. While diabetes type 1 is not a hereditary disease, the weakness of the immune system may be a hereditary thing. And it's true. We see families that are more likely to have autoimmune disease where the immune system gets confused and starts to fight itself. Things like diabetes type 1 or rheumatoid arthritis or lupus. These are diseases where the immune system is confused. And yes, they tend to run in families.
So you just have to be maybe more cautious if that's been running in your family, that type of thing.
Yes, that's fair.
That's the short answer.
But I'm not sure that you can always control it. Sometimes things happen we have no control over, and these things just happen.
Okay, so there may be genetic involvement, but do the best that you can.
Right.
Would it be fair to say that the best to do is to breastfeed your child if you can?
We know that people who are breastfed for at least 1 year of life have fewer allergies. It tends to strengthen the immune system if just breast milk is used. People are more likely to have allergies and problems with the immune system if they are fed foods other than breast milk before 6 months of age, and some might say 12 months.
What is the big deal about getting diabetes anyway? I mean, what does it do to your body?
Good question. We've got this whole issue of the disease. Insulin, the Paul Revere hormone, is necessary to tell the cells the energy is coming so they can open up and let that energy in. If that's not there, the cells don't get the energy. If they don't get the energy, in essence, they die. We call, another name for this type 1 diabetes is insulin-dependent diabetes. And it's insulin-dependent because if people don't have insulin, they will die generally within a few days to a week.
Is the insulin used in the body? Is the brain different than the body in that sense?
Oh, okay. There are some tissues in the body that don't need insulin to take the sugar in. The brain is one of those.
So that's why you say they die over a number of weeks or months or whatever.
Well, it's actually days to weeks.
Days to weeks.
It's a shorter period of time because the muscle cells are not getting the energy, and death ensues in relatively short order.
So it's a dangerous thing. Does it cause any other problems in the body, or is there something else we need to know about it before we even talk about that?
If it is untreated, death comes quickly. Now, maybe another question to ask before we actually talk about the problems that diabetes causes in the body is, what's the best way to treat it? And I've lectured on this to kids in the 5th and 6th grade. Explain the process, and you simply ask the question, well, what's the best way to treat it? I'm the patient, you're the doctor, we say to the 6th graders. How do you treat it? Well, it's obvious, you give insulin.
Okay.
And that's in general what we do. A person doesn't have insulin, we give a little bit of insulin, the cells say, I need that stuff, they open up, and the energy goes in and we've solved the problem. Now, it gets complicated getting the insulin there at just the right time.
You have an interesting graphic about insulin resistance and kind of how all this works. Let's look at that and explain what we see here.
Okay, well, you can see the food coming into the stomach and kind of mixing up by a circuitous route. It goes to the blood, and then it's trying to go to hungry cells. So without the insulin, of course, it won't go into the cells. And so we have cells, and there's a word on the bottom of the screen there that says insulin sensitivity. These cells will respond quickly to insulin. People with other kinds of diabetes often take large doses of insulin to get the cells to take the insulin. But in type 1 diabetes, generally, just a small amount of insulin is needed.
Okay, so the insulin, what was that called? Insulin sensitivity is heightened with someone that has diabetes type 1 because they simply don't have any insulin around. When they have it, they say, hey, they're here, Paul Revere's here, or whatever.
Yeah, open up, let me in.
And that's because they can get the nutriment they need, I guess, in the cell. That's why they're so excited.
The energy can go in. Now, you and I assume you don't have diabetes. I don't have diabetes. We would generally make about 30 units of insulin a day. A type 1 diabetic, when they are treated for their diabetes, really shouldn't need a large dose of insulin. It should be somewhere in the range of 20 to 30 units a day because the cells of the body are very sensitive.
And so that's the treatment then. I mean, once you've had that autoimmune system that's knocked out your pancreas, so to speak, then the only treatment is insulin, and that's why they have to get these shots and whatnot. And you're saying it needs to be just a small dose. Anything else you need to tell us about insulin?
It can be given in different routes. There's a lot of things about the medicine and the science of insulin. What we used initially was an insulin that lasted about 3 hours, called regular insulin. And if it lasts that long, a diabetic, type 1 diabetic, would take this with their meal or just before their meal. That would help bring the energy out of the blood, put it into the cells, and then one would expect that insulin to wear out after about 3 hours. So that's generally what we've used. We've also had a longer-acting insulin, a variety of insulins. Insulins that last 6 to 8 hours, for example, the NPH, and that would allow you to take a shot in the morning and it would be covering your noon meal because it generally lasts that long. So there's a variety of different insulins. The treatment for type 1 diabetes is in essence to give the insulin.
So, I mean, when was insulin invented in the sense, I mean, it's always been there, but when did they get it so you could actually inject it? How long has that been around?
You're right, the Creator designed it.
Right.
And to not have it is kind of, well, an enemy has done this, I think Scripture says, and it's a disease process. It's not the way it's supposed to be at all. We finally discovered insulin in about 1922, 23, somewhere along in there, and began to use it at that time to help bring the blood sugars down.
And they've just been perfecting or further sophisticating
Right.
that. Now, let me ask you this. It would appear to me that if the Creator designed the body to be very responsive to whatever the needs are, you know, as they come, that just when you need insulin, it's there. When you don't need it, it's not there. Is there a hazard? I mean, you say you give a shot, you know, and then it's there for all day. But is there any cost to the body when the pancreas is not working and we have to sort of do this shot thing?
Yeah, we as human beings just don't do as well as the Creator does. When He designed the pancreas to work, it was responsive. When we try to guess what we're going to need, then we run into problems. And we have problems, two different sets in type 1 diabetes. One, the blood sugar's up too high, and the other one, the blood sugars get too low. If you gave too much insulin and the sugar went too low, there wouldn't be enough sugar for the brain. When the blood level gets below 50 milligrams per deciliter, then there's not enough for the brain. The brain stops working. People stop thinking.
That's when they pass out.
That's when they pass out.
Okay, so that's when it's too low. What if it's too high?
Well, if it's too high, people's brain tends to get foggy. There's something called glucose toxicity when the blood sugar is over 200. Body just doesn't work as well. Everything works with less efficiency, and people often feel a little groggy in the brain.
Okay, we've talked about what that does to the sensorium, or the senses of how we feel. But what about the cost to the body itself? Is it costly to have high sugars versus low sugars in the body itself?
The most dangerous is the low blood sugar, because that would kill you if you didn't get it taken care of.
Sure.
But over the long haul, we have problems with elevated blood sugars. Too much energy, too much sugar in the blood vessels over time actually ends up causing changes in the small blood vessels. I think we have another graphic to kind of talk about this.
We're going to come back and look at that graphic right after the break. We're talking with Dr. George Guthrie. We're talking about type 1 diabetes, and there's good news in the second half as well. There are new treatments and things about type 1 diabetes you simply need to hear, so come back after the break.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABM, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. George Guthrie about type 1 diabetes. And we've learned, Dr. Guthrie, that this is an autoimmune type thing where the cells are attacked that make insulin. It's not something you're just born with. It comes as a result of something that was ingested. We talked about some different things, or something that's eaten, or
An infection.
An infection.
Yeah.
And it's not caused by any particular thing. It's just the response of the body. And then we've talked about really what the problem is with diabetes. When the sugar goes too low, we pass out. When it's too high, we also get kind of messed up as well. But then we were talking about the cost to the body itself, and we were looking at, we were about to ready to look at a graphic. So help us look at that graphic and explain to us what's happening to the body with diabetes.
Okay. As the blood sugars go up, and they're up over time, they begin to affect the small blood vessels in the body. If that happens to be in the eyes, it of course leads to blindness. If it happens in the kidneys, it leads to kidney failure. If it happens in the nerves, it leads to neuropathy. That's that burning, numbness, pain that comes in the nerves. And of course, if it bothers the small blood vessels in the legs, one might get an infection. Your body wouldn't be able to fight it. That infection, you've probably heard of gangrene, leads to amputation. So the potential problems from not keeping those blood sugars under control are rather serious.
Now, you've said that the only treatment for type 1, at least at this point, or for many years, was just having insulin. And you said there's even some more new insulins that are, you were going to tell me something about them.
Our goal in treating type 1 diabetes is to try to get the blood sugars as close to normal as possible. We know now from some rather large scientific studies that if we do that, we can minimize those complications, maybe even make them go away, certainly put off the problems for years. And so that's led us to try to develop new insulins, new ways of giving the insulin that more closely reflect our physiology. We end up having a very rapid acting insulin now that lasts just like 45 minutes or so. You can take it about the time you eat. The way you and I function, our pancreas, when we eat, the insulin comes out, the energy gets put away, and the insulin goes away. And then it can be mirrored with these new injections.
So if you decide to have some kind of very simple carbohydrate, I don't want to pick on any kind of food.
Okay.
If you, or some kind of candy bar or something, you say, okay, I need my shot. You can do that now.
You can actually cover that for over a short period of time. Another problem we have is actually having a low-grade insulin in the background to keep the liver from pouring out sugar, because insulin lets the liver know that energy is around, so you don't need to make any more. If the insulin gets low, the liver starts to pour it out. And in order to meet that need, we have an insulin that lasts a long time, 36 hours. And so if we have a little bit of that in the background, and then we have the real short acting on top of each meal, it's much easier now to actually fashion the insulin dosage after what normal physiology is.
Do you have many people come through your Wellspring Diabetes program that are type 1 diabetics?
Not very many. Lifestyle is not a real good, well, it doesn't cure, it doesn't reverse type 1 diabetes. You see, there's a problem with a dead pancreas. But those people that do come through and move to our way of treating type 2 diabetes, that is a plant-based diet, we find that the blood sugars don't shoot up and down as much, and they're easier to control. Certainly it's not curative.
So it's kind of easier on the system.
Much easier on the system.
Okay. Well, you know, you were sharing with me as we talked about this that there actually is some new research and there's new things that have been done that really give hope to type 1 diabetics. You talked about an Edmund approach and a Rossini approach, or whatever. What are these?
Okay. There is an Edmund protocol, actually comes out of Canada, looking at ways to transplant new beta cells into the pancreas. You see, if a type 1 diabetic's pancreas has all the beta cells dead, is there a way we can put new ones in? And in essence, there is a protocol by which the body can actually accept those. Unfortunately, it still takes the anti-rejection drugs, which can be pretty strong and don't always leave a high quality of life, but that is encouraging.
So that's the Edmund approach. They actually open you up then and put those cells in, or do they? What do they?
No, it can actually go in. It's my understanding. I've never done it. With a catheter, these stem cells, kind of motivated to be beta cells, are put into the, and they can set up shop really anywhere.
Is that right? Mm-hmm. So they actually put them right in there, and then they have to have the problem. The downside, though, is those those drugs to suppress the immune system.
That's right.
Which was the thing that caused the problem to begin with, right?
Right. So it's depressed immune system, bit of a
challenge. You can get infections. You can have all kinds of problems with that. Mm-hmm. Okay. Well, then what about what was the other guy's name? His Rossini.
Dr. Rossini. Yes, from the University of Massachusetts. Presented in 2003 to the American Diabetic Association, a lecture which I was privileged to hear. I'm excited about it because he's come up with a method which works in mice. We haven't got it to humans yet. But a method to actually allow the transplant of these beta cells without needing the immune suppressant drugs later on.
And he's doing this in mice.
He's doing this in mice. In essence, preparing the body ahead of time. You see, when a new protein from outside the body comes in, the immune system comes out and looks at it and says, "Does this belong? Is this us or is this not?"
What's its last name? Yeah, right.
Yeah, I mean,
does it have the right uniform on?
Does it have the right uniform on? And the response is actually decided by these macrophages who grab onto this protein.
What are they called?
Macrophages.
Oh, I thought you said Macintoshes.
No,
macrophages. Okay.
Macrophages look at this protein and then look at it and say, well, I'm going to present this to the immune system. And they hand it over to another immune system cell, which then will create a response to reject the protein that has come in. Well, what Dr. Rossini has done is, in essence, developed an antibody against a couple of the connections. You know, when the rockets dock, they come together. Well, when the immune system comes together, there's some docking ports. So he blocks those, and then actually gives a transfusion of some blood from the donating animal, which has cells in it that say, hey, that's okay. And as they has a chance to build up, they start telling the immune system, you don't have to fight that. It's okay.
One of us.
It's one of us. And then the connection between the two is actually blocked for the month or two around the infusion of the beta cells. And I'm excited because it's working. And I suspect that within the next 5 years or so, we'll probably be seeing it in human beings as well.
Wow. So let me see if I understand this, because you said quite a bit right there. Let's go back to it again.
Okay.
So the Rossini approach is to kind of like when I'm just listening. I'm trying to be the person that's listening to us today.
Good.
What happens is he wants to put those cells back in the pancreas so they can make insulin
Sure.
again. But the problem with doing that is the body always attacks them and kills them.
Right.
So what he's doing now is beforehand laying the foundation so they'd be accepted. It's kind of like disrupting the homeland security system of the body.
Exactly. Homeland Security is blocked
That's right.
until the message can get through the body's government that these are okay guys.
Okay. And then once that happens for a certain amount of time, and they probably check the levels and everything, and then that's when they put the cells in. And then
There's actually an injection ahead of time, and then at the time that the beta cells go in, and then for a couple of weeks thereafter to cover that immune system.
Excellent. Well, you know, in our last couple of minutes, we've talked about diabetes type 1. We've talked about some pretty hopeful things. We've talked about some things that maybe would... I want to come back to the beginning again. Is there any way to prevent this type 1 diabetes?
Oh my, it's an autoimmune disease. The best thing we can do for ourselves is to stay healthy. I think I mentioned already that breastfeeding is probably one of the best ways to keep the immune system strong, and I would say at least for the first year of life. And then to eat a diet high in the phytochemicals and other things that strengthen the immune system. A plant-based diet is in general best for that. And that gives the person the best chance to avoid it. Some people, it's going to happen to. They can't avoid it.
We've been talking with Dr. George Guthrie. We've been talking about diabetes. And we've talked about not just all diabetes, but type 1 diabetes. We've found that there is hope out there. There are some methods right now where there can be transplanted beta cells, but there's even hope now to be able to diminish the possibility of those being rejected. In our last couple seconds, we have just a couple seconds here. What spiritual lessons can we learn from this whole discussion today? Is God for us or against us, Doctor?
God is gracious, and I'm glad He's given us minds to learn and to make choices to help overcome the troubles that are around us. I see God's wisdom here.
We've been talking with Dr. George Guthrie. We've been talking about disease. We've been talking about diabetes type 1. The good news is we know what it is, and the Lord has given us grace to understand that. We're glad you've watched today and learned some hopefully helpful things for you and your journey. Maybe you're struggling with disease. We hope that today's program has been a blessing for you. If you do need more help, don't hesitate to give us a call here at 3ABN. We'll do whatever we can, and we hope that as a result of watching this program, you have health that lasts for a lifetime.